It is indeed an immense privilege to be present this morning on the ground of Mary Charles Hospital to engage in such an essential activity, the recommissioning of the dental clinic and the re-establishment of the vital ambulance and accompanying emergency management service. It is a privilege because this hospital represents one of your very own. It represents all of us, but your very own Mary Charles George. Her name is on his hospital because of her sterling contribution to nation building over many years. Mary Charles George, if some of you did not know, emerged in a period when men dominated education. There were only male headmasters, and she piloted her way through and became a headmistress which served many schools in an era when men dominated. She was my teacher as well, so I know. And so the name will live on in this institution, and the quality of service that you deliver should also reflect the quality of service that she delivered when she was a teacher. This is a time for much celebration indeed. For today, the Team Unity government is delivering on yet another strategic promise outlined in the National Strategic Plan for Health 2017-2021, as it embraces the United Nations Sustainable Development Goal number 3, family health, good health, and well-being. Research has revealed that there is a significant interrelationship between oral health and general health. However, with the increasing prevalence of non-communicable chronic diseases, NCDs, which continue to dominate developing countries, the burden of NCDs must be addressed holistically as well. Moreover, there is also a strong correlation between several oral diseases and non-communicable chronic diseases such as cardiovascular disease, diabetes, cancer, and chronic obstructive pulmonary diseases, just to name a few. And there's also further evidence that severe periodontal disease is related to lifestyle and dietary habits which influence the development of dental cavities and oral cancer. The Ministry of Health is too well aware that the greatest burden of diseases is usually on the disadvantaged and socially marginalized. Given the extent of the problem, therefore, oral diseases are a major public health problem because their impact on individuals and communities as a result of pain and suffering, man-hours lost in the workplace, impairment of function, and reduced quality of life is considerable. Thus, we have pledged our commitment to provide health care for all in a holistic manner for the entire population, thereby reducing any perception of inequities. For we have recognized also that the World Health Organization's global strategy for the prevention and control of non-communicable diseases is a new approach to managing the prevention and control of oral diseases as well. The new dental clinic to be commissioned this morning is an attestation of that very fact. And that's not all. This morning, we are all commissioning a new ambulance with EMT service at this institution. Ambulance services are the primary providers of a 24/7 response to medical and trauma-related emergencies. Such a service at Mary Charles Hospital will provide a disciplined and organized system with the necessary equipment, expertise, and experience in emergency intervention, in emergency assessment, in management and transport of patients of a variety of situations, and allowing a timely response for the appropriately trained EMT personnel and the qualified healthcare workers to address medical emergencies. Undoubtedly, such a system will increase efficiency and provide an opportunity for an emergency service with relevant expertise to influence the health outcomes of our people. This is a pellucid indication that we at the community and ministry level do understand. We understand the fundamental importance of preventative actions to mitigate health risks and diseases and disease prevalence in our nation. Let me repeat. We at the community and ministry level do understand. Yes, we understand the fundamental importance of preventative actions to mitigate health risks and diseases. I say that because there is every reason for us in our nation to elevate the level of discourse by those who are clinical as well as those who are experts in the field of health. Elevate the conversation about NCD trends and how we can change the trend downwards rather than maintain what is a global level. We must pioneer in this nation to reduce the trends, to reduce those trends which seem to be evading the whole world. There is every reason for us in this nation to recognize that we must accept chiropractors and naturopaths as part of our healthcare infrastructure by moving in the direction of having our laws, our medical act, our medical laws, accept and recognize them as part of the healthcare infrastructure. There is every reason that we must encourage alternative methods of maintaining health rather than going almost always to the chemical reaction from chemical drugs and the damage that they do to individuals. We have to get our NCD prevalences to trend downwards. So we're here this morning. We're here this morning to demonstrate in several ways that we have kept our promise and to espouse the ministry's motto. People first, quality always. St. Kitts and Nevis has made major strides in the development of quality health care delivery. And as a team unity government, we will continue to do so while we continue to demonstrate our leadership and during our political tenure. We intend to continue to advance our priority for disease prevention so that we expect in the communities like these discussions to be taking place about how to eat and exercise and so on to prevent chronic diseases. We intend to continue to advance our priority for disease prevention and reduce modifiable risk factors and elevate our processes accordingly. We must stay on top of that agenda. Too many of our people are losing limbs that they should not be losing. And we must begin the conversation, elevate the conversation to the point where it is prevented rather than a fait accompli. Permit me, therefore, at this point, to recognize the dedication of the persons who constructed this outfit, the dental clinic. And permit me also to offer deepest gratitude to the benefactors of the ambulance, Mr. Kutiba Al-Ghanim through Kevin Isaac. I want to thank them for their magnanimous contribution to this community and to this nation. These actions of these men and women have defined the very space in which we are now gathered. And so once again, I say I thank them profusely for their contribution to our community and our health sector. Thank you very much.
Stay up to date with news, programs, and activities of the government with SKNIS. Like us on Facebook. Listen to us on SoundCloud. Follow us on Twitter. And watch our videos on YouTube. Connect with us today. SKNIS, St. Kitts and Nevis Information Service.